So I just wanted to continue on the thread of mental health awareness because it is Mental Health Awareness Month. And mental health can be chronic, which means that it happens all the time. It's constant. For example, schizophrenia. A lot of people with schizophrenia, schizoaffective. It won't go away, right? It's permanent in a way. We can help reduce the symptoms, but there's no cure as of yet for schizophrenia. Another one that can be chronic is bipolar. Again, we can help the symptoms with skills that I talk about on my videos. There's also people with depression that's chronic, that can be a low mood all the time, or it just comes up whenever, right? Which is different from like the seasonal disorder. So there's seasonal depression where people can get depressed during the winter time, which is not chronic, which is weird because it could happen every winter, which is not chronic, but also it's seasonal, so it's considered not chronic. However, whether you're dealing with chronic mental illness or a temporary loss, a temporary anxiety, panic attacks, or chronic panic attacks, chronic anxiety, the skills are the same, because what you're doing is reducing the symptoms, the heavy breathing, the heart rate that's going up. With depression, it's reducing the low mood, the motivation, increasing motivation. And the hope is to get you out of that space, get you to a place where you're clear thinking and you're able to make better decisions so that you can improve your mood, right? And some people with these diseases, mental illness, disorders, they call them, can overcome them. There have been people that have had chronic depression, have learned these skills, and have gotten out of it so that they are clinically no longer depressed. Same thing with anxiety, same thing with, even borderline personality disorder, which is trauma-based. People can recover to the point where clinically they are not, they don't meet the criteria for that mental illness, right? So I don't want to say cured, but because there's always a relapse. You can always go back to that, right? Just like with substance use disorder. But you have gained enough skills to not only control the symptoms, but improve your way of life so that you can prevent the symptoms from coming altogether and just have a better life worth living. So there's different, like I said, there's different types of mental illness. There's different, whether it's chronic or not, but learning how to deal with the symptoms is the first step to, gaining control and gaining clarity so that you can reduce the symptoms and possibly even no longer be classified with that mental illness. And it's a wonderful thing. It's a wonderful place. If you're stuck there, if you're having difficulty, that's what I do. Not only am I going to school for a therapist, but I'm also a life coach, and I'm also a woman in recovery from mental health and substance use. So I have experience, I have knowledge, and I really just want to help people get to the place where they are no longer suffering from any of the disorders that I just spoke about. Anyway, mental health is real, mental illness is real, and we're out here trying to crush the stigma, right? It doesn't make you a bad person, it doesn't make you a weak person, but reach out to me if you have any questions or if you'd like any help in any of those areas. If I can't help you, I will redirect you to someone who can. I hope you have a wonderful day, and until next time, please be well. Peace.